In this video, I will go over some of the high yield points for the infectious agents that are listed in this question. So the first organism is Trichomonas vaginalis, which is a sexually transmitted disease that presents with a yellow-green vaginal discharge that is malodorous and is frothy. And usually this organism causes inflammation of the cervix, so therefore the name strawberry cervix is sometimes given to it. And then the treatment for Trichomonas vaginalis is the metronidazole. The next organism is Giardia lamblia, and it may look similar to the first organism that you saw here, but the difference is that while not apparent in this image, Giardia lamblia usually have two dark points bilaterally, while compared to Trichomonas vaginalis, which usually has a central coloring. In any case, Giardia lamblia is associated with a fatty, foul-smelling diarrhea that is usually associated with swimming in lakes or streams in camping trips. And how Giardia lamblia works is that it will cause flattening of the villi in duodenum or jejunum, or alternatively it will block the surfaces of the villi, and thus because of the malabsorption these patients will develop diarrhea. And the treatment for Giardia lamblia is metronidazole, same as Trichomonas vaginalis. Now, one important factor that helps defend against Giardia lamblia is the IgA, and thus patients that are IgA deficient, like for instance 1 to 2% of patients with celiac disease that are IgA deficient are prone to infection with Giardia lamblia. Other conditions like selective IgA deficiency, Bruton's A gamma globulinemia, ataxia telangiectasia, and so on. So any condition that is associated with IgA deficiency makes patients prone to infection with Giardia lamblia. The next organism is Plasmodium species, which include the Plasmodium falciparum, Plasmodium Malaria, Plasmodium vivax, and Plasmodium ovale. And these two conditions, Plasmodium vivax and Plasmodium ovale, are associated with 48-hour fever spikes, while Plasmodium malaria is associated with 72-hour fever spikes. And then finally, Plasmodium falciparum, it causes erythrocytes to become sticky and block these small vessels, as a consequence of which it will cause cerebral symptoms because of the blockage of the cerebral vessel. So this is a really dangerous form of Plasmodium species. And the treatment for these two conditions is chloroquine, while for Plasmodium vivax and ovale, which will persist inside the liver, you will have to treat them with chloroquine plus primaquine. So chloroquine plus primaquine is used for the treatment of Plasmodium vivax and Plasmodium ovale. The next parasite is Ascaris, and these patients will present with abdominal pain, vomiting, as well as obstruction of the bowel or bile ducts or pancreatic ducts. And the treatment for Ascaris are bendazoles, for instance, albendazole or mebendazole are used for the treatment of Ascaris. The next infectious agent is Balantidium coli, which is a ciliated parasite. So this is the only ciliated parasite that will infect humans, and is associated with dysentery. So here is an example of a trophozoite where you can see the cilia on the surface of the parasites. And this is an example of the cyst, which was shown above here. So here you can see the cyst with a kind of bilobe nuclei shown here. The next organism is Entamoeba histolytica, and as you can see, it will present with nuclei inside that have spike shapes. So here you can see that there are spike shaped nuclei that are present inside the Entamoeba histolytica. And so here would be a schematic drawing of Entamoeba histolytica. So you can see that there are nuclei with spikes in there. So if you magnify those, you will see a nuclei like this. So there are spikes inside these Entamoeba histolytica. In any case, these patients that are infected with Entamoeba histolytica will present with tenesmus, which means that they have constant feeling of the need to go to the bathroom. They would also present with right upper quadrant abdominal pain, as well as a bloody diarrhea. And then the lesions have a flask-like appearance. So for instance, if you have the intestine here, so let's say here is the intestine, and then a lesion appears here, the lesion would have a flask-like appearance like this. So this would be characteristic of infection with Entamoeba histolytica. The next organism is Babesia, which is transmitted by the same tick as Borrelia, which is Ixodes tick. So Ixodes tick can transmit both Babesia and Borrelia burgdorferi, and thus both babesiosis and Lyme disease are usually seen together. And macroscopic examination of red blood cells of patients with Babesia will show Maltese cross. So here you can see the cross formation, where there is like an X-shaped formation of the inclusions inside the red blood cells. And so the way I memorize it is that Ixode ticks are associated with Maltese cross, which is seen with babesiosis. And the clinical symptoms of these patients is malaria-like symptoms. For instance, they will develop fever, jaundice due to hemolysis, as well as splenomegaly. But then one critical difference is that unlike malaria species, which can cause periodic fevers, Babesia does not cause periodic fever. In any case, patients with babesiosis are treated with clindamycin plus quinine. And then I forgot to mention that patients with Entamoeba histolytica are being treated with metronidazole. And patients with Balantidium coli are being treated with tetracycline. And then the final organism is schistosoma, which is a parasitic blood fluke, and there are 3 different species of schistosoma that you have to be familiar with, which include Schistosoma mansoni, Schistosoma japonicum, and then finally Schistosoma hematobium. And then the first 2 will grow in the vessels of the mesentery, and thus they are associated with liver and intestinal symptoms, while Schistosoma hematobium will grow in the blood vessels of the bladder, and thus it's associated with increased risk of bladder carcinoma, particularly in patients from Egypt and Africa who have infection with Schistosoma hematobium. And then one final point is that patients with schistosoma infection are being treated with praziquantel. And that concludes our discussion.